So today we are going to deal with a new condition, that is cystitis. So I'll just tell you a small tip, okay? In medical surgical nursing, any word ending with ITIS, I repeat, in medical surgical, any word ending with ITIS, its definition means it's an infection or inflammation of that particular organ. Okay, now today we are going to deal about cystitis. Cystitis means it is an infection, inflammation of the bladder. Bladder is also known as cyst. Okay, it doesn't mean that cyst means it's a what to say, extra growth and all. Bladder is also known as like cystitis. We can say it is an infection, inflammation of the bladder. Okay, now with a painful maturation. Okay, now usually what is the cause of cystitis? Okay, usually cystitis is most commonly seen in women because they have UTI, because they what to say, they control the bladder without urinating for a long time and all. Because of that, the bacteria growth will happen, and usually seen in females. Okay, then abnormal bladder control. Okay, then constipation. Post-menopausal woman. Your post-menopausal, post means after, menopausal period means after when menopause. Menopause means menstruation stoppage. Okay. Then we can see cystitis in lower immunity patients like HIV or chemotherapy or radiation therapy of a cancer patient. Fine. So this was all about definition and etiology. Now we are going to deal with pathophysiology. Now pathophysiology means the root of the infection occurring. Okay, so due to the etiological factor, okay, for example I can take UTI. Okay, because of UTI, what happens is like the bacteria enters the urinary tract. Okay, bacteria enters the urinary tract through urethra, because urethra is a lower thing, right? So bacteria enters through urethra, it gets multiplied, okay, and infection occurs. Fine, and that can lead to signs and symptoms. Fine, pathology is clear, pathophysiology is clear. Due to etiological factor, bacteria enters the urinary tract through urethra. Okay, it multiplies, it causes the infection, and it ends up in signs and symptoms. Now what are the signs and symptoms usually seen in cystitis is like the person will be having dysuria, difficulty, okay, hematuria will be there, pain and pressure during maturation. Okay, frequency will be there for the patient, frequency of urinating, urinary retention and urinary incontinence will be there, which are the conditions we are going to learn detailing. Okay, so when the condition I will be explaining more about it. Fine. So these are all the clinical manifestation. I repeat: dysuria, pain and pressure while urinating, hematuria, urinary retention, urinary incontinence for the patient. Okay. Next one is diagnostic evaluation. Now, if a person is having cystitis, what are the diagnostic evaluation we can do? We will have a thorough history collection. We will have a thorough physical examination. Now, we will be collecting the urine. See, in the review also I said urine analysis will be connected. So when we ask the patient to get or collect the urine, we'll ask the patient to get a midstream urine. Okay, like when the person is urinating, the first urine we'll ask them to leave, and the middle urine we will ask them to collect, and the last urine we'll ask them to leave it. Okay, so the midstream urine, because it will give the exact amount of bacteria present in that or infection. Okay, then cystoscopy. Scopy means visualization. So cystoscopy, cystitis means it's the infection, inflammation of the bladder. So cystoscopy means it's the visualization of the bladder. Okay, to know whether what is the infection or is there any obstruction and all. Okay, then moving on to the management. As it is a bacterial infection, we will be having antibiotics. Okay, we can give anything, Ciplox, okay, or any other bacteria like Taxim. Okay, then analgesics. Patient is having pain, we have to give analgesics. Okay, acetaminophen we can give, for example. Then a patient is having, it's an infection, so obviously the person will be having fever, so we can give antibiotics and symptomatic treatment. That's all about the management. Okay, so I repeat, in general, cystitis, it's an infection, inflammation of the bladder, usually occurring due to frequent painful maturation. Okay, etiology, UTI recurrently, which is occurring in female, abdominal bladder control, constipation, post-menopausal woman, and low immunity persons such as HIV or any cancer patient who have undergone chemo and radiation therapy. Pathophysiology, due to etiological factor, bacteria enters the urinary tract through urethra. It gets multiplied. Infection occurs, and that leads to signs and symptoms. Now, what are the signs and symptoms? Dysuria, hematuria, okay, pain and pressure during passing urine, frequent urination, urinary retention, urinary incontinence. Diagnostic evaluation, history collection, physical examination, urine analysis, cystoscopy. Management, antibiotics, analgesics, antipyretics, symptomatic treatment. If the person is having vomiting, we can give antipyretics and all. Antiemetics. Okay. So this and all about cystitis. I know I am a bit speed up in while taking this and all. See, if you have any doubts, get back to me. I am ready to explain you anything. Okay, and anytime. Bye.